Take a close look at this ancient human skull and the smooth opening carved directly into it. How do archaeologists know for certain that this person actually survived such an invasive procedure? The secret is written in the bone itself, because living bone regrows when a patient survives. A sharp cut leaves jagged edges, but months of healing smooth those borders into rounded, polished bone. We are ranking 8 surgeries, performed thousands of years before the invention of modern anesthetics. Surprising new evidence shows some ancient practitioners achieved higher survival rates than 19th century military surgeons. Number 8. Setting broken bones. Ancient Egyptian mummies frequently show limbs bound tightly with wooden splints, linen strips, and stiff resin. Setting a fracture requires pulling the limb into alignment before immobilization locks it into place. If a severe fracture is set improperly, the bone heals crooked, creating a permanent visual record. Numerous recovered skeletons show perfectly straight fused bones, proving that early healers understood skeletal biomechanics. Without pain relief, setting a major limb required immense physical force and extraordinary patient endurance. Number 7. Prosthetic limbs. Archaeologists in Egypt unearthed a remarkably crafted prosthetic toe fashioned from carved wood and dyed leather. What elevates this discovery is the clear presence of physical wear along the bottom contact surface. The smoothing proves the owner wore it continually during daily life, rather than just for burial preparation. Fitting a functional false limb required surgical amputation and precise shaping to avoid pressure sores. This early biomechanical device restored balance and gait to an amputee thousands of years ago. Number 6. Cataract surgery. Ancient physicians practiced an invasive ocular technique called couching to treat severe cataracts. A sharp needle was inserted into the eye to push the opaque, clouded lens down into the vitreous cavity. Displacing the clouded obstruction allowed light to enter the eye once again, partially restoring sight. While focus remained extremely blurry, patients shifted from total blindness to recognizing shapes and motion. This risky procedure appears regularly in ancient Indian medical texts and Egyptian papyrus records. Number 5. Dentistry with a drill. In Pakistan, archaeologists discovered human molars from a Neolithic site showing precise conical drill holes. These ancient dental cavity treatments were performed using tiny, rapidly spinning flint drill bits. The drilled enamel surfaces show distinct wear patterns from subsequent chewing over several years. Radiocarbon testing confirms these teeth are roughly 9,000 years old. The patients continued living and eating normally, long after surviving the excruciating drilling process. Number 4. Nose reconstruction. The Sushruta Samhita, an ancient Indian surgical text, details complex nasal reconstruction techniques. Surgeons sliced a flap of skin from the patient's forehead and rotated it down over the nose area. Crucially, the skin flap remained attached at the base to preserve vital blood supply while healing occurred. Modern plastic surgeons still utilize this exact paramedian forehead flap principle in reconstructive procedures today. Surviving severe facial trauma restoration without infection control represents an astonishing medical achievement. Number 3. Skull plating. In ancient Peru, surgeons placed thin hammered plates of metal, including gold, directly over cranial openings. One extraordinary specimen features a precious metal plate seamlessly binding a severe fractured cranial bone. The surrounding bone shows dense, fused remineralization, tightly holding the metal implant in place. This proves the patient not only survived the implantation, but lived long enough for bone growth to secure it. Implanting metal into a living skull without modern sterilization stands as a jaw-dropping medical miracle. Number 2. Amputation. A prehistoric burial site in Borneo revealed a human skeleton missing its lower left leg and foot. Forensic analysis revealed clean, deliberate surgical cuts across the bone rather than an animal attack. The leg was amputated during childhood, and extensive healing proves the individual lived for years afterward. If the radiocarbon dating holds, it pushes successful human limb surgical amputation back 30,000 years. Surviving blood loss and fatal infection in a tropical rainforest environment requires sophisticated medical care. Before revealing number 1, remember our ranking criterion is based on surviving impossible surgical procedures. Number 1. Trepanation. Trepanation involves cutting, scraping, or drilling directly through the human skull to expose the brain membrane. It is the oldest documented surgical operation in human history, first appearing during the Mesolithic era. At certain Neolithic archaeological sites, between 5 and 10% of recovered skulls show trepanation holes. This high frequency proves brain surgery was a routine medical practice rather than an extreme last resort. Trepanned skulls have been unearthed in Europe, Greece, Mesopotamia, China, Russia, and across South America. Astonishingly, traditional practitioners in East Africa were still performing cranial trepanation into the 1990s. Peru contains more trepanned skull specimens than the rest of the entire world combined. Dr. John Verano of Tulane University studied over 800 Peruvian skulls, finding some with 7 separate holes. A 2018 study led by Dr. David Kushner analyzed these skulls by measuring bone healing to track survival rates. Between 400 and 200 BC, long-term patient survival following brain surgery was around 40%. Between 1000 and 1400 AD, survival rates skyrocketed as high as 91% in sample groups. During the Inca Empire period, overall surgical survival consistently averaged between 75 and 83%. For comparison, cranial surgery during the American Civil War, 400 years later, carried a 46 to 56% mortality rate. Ancient Inca surgeons achieved higher survival rates than modern doctors operating in the 1860s. The dramatic improvement came from refined surgical technique and avoiding perforation of the protective dura membrane. Most trepanation patients were adult men injured in combat by blunt weapons like sling stones and heavy clubs. Modern neurosurgeons still perform modern craniotomies today for the exact same clinical reason, relieving swelling fluid pressure. Which of these ancient medical achievements surprised you the most? And would you ever trust an ancient surgeon? Leave your thoughts in the comments below and like and subscribe for more deep dives into ancient history.